Although government has done a lot to scale up services in HIV and AIDS, polio, and increasing access to health through the construction of health centers, mental health is an area that is largely still ignored. The 2010 Human Rights Report shows that mental health continues to be neglected despite the fact that it contributes to about 13% of Uganda's disease burden.
The patient to doctor ratio stands at 1. One health professional, one psychiatrist for 1,142,857 patients.
Currently, Uganda has only 28 psychiatrists, too few to handle this enormous disease burden. The report also faults the Mental Health Act. The archaic law is said to regard mental illness as a crime, with patients treated as suspects. The result is continued denial of mental health patients of their personal liberty, social exclusion, failure to access justice, disinheritance, and loss of gainful employment.
The whole act does not recognize them as human beings. It's like these people have no legal or social capacity, and that inevitably excludes them.
Female mental health patients are also said to face sexual exploitation. The report shows that access to health services is also hampered by non-availability of health workers.
And if the health facilities are not available or are closed for a week or days, then patients cannot access these services. At the end of the day, they could die, which is a violation of their right to life.
It recommends increased budgetary allocation to the health sector, as well as strengthening of monitoring and supervision. Other recommendations are the passing of the draft Food and Nutrition Bill into law and a review of the Mental Health Act.